Hi, I'm Brad Storm with Premier Plastic Surgery, along with Dr. Gonzalez and Dr. Moore. There's a new implant out, and we're excited about it, and there are a lot of questions, and so I thought we'd do a short video blog on the new 410 implant. It's made by Allergan. It's called the Gummy Bear implant, or the 410 implant, or the highly cohesive gel implant. This is newly released by the FDA, but it's an implant that's not new or experimental. The rest of the world has had this implant for over 20 years. In the United States, we have 10 years of experience with it, and I've had it as a FDA clinical investigator for 7 years. So this implant isn't brand new, and it's in fact the most commonly used shaped silicone implant in the world. It's been called the most studied implant in history because that was the requirement for the FDA to release another new implant. And this is the 410 implant. It's still very soft, much like the standard round implant, but it is just a little bit stiffer. We'll have implants for you to look at when you come to the office if you decide this is something you're interested in. But suffice it to say, it's not as stiff as a gummy bear candy. The thing that I want you to remember about this implant, if you remember one thing, and that is that it's form stable. Form stable means that it keeps its shape better than a soft liquid gel implant that I have here on my left side. This implant is great for breast augmentation. It's great for adding volume to the breast. And I don't think that the new implant is going to replace the rounds, at least not anytime soon. But there are some specific advantages to the 410 implant over the standard round implants that we have. This implant keeps its fullness on the top. This implant is more formed by the envelope your body makes around it. It also is filled completely, whereas this implant, they leave a little room in the shell for movement, and that creates some, by necessity, creates some capacity for rippling and ridging that you may see or feel. We can avoid this most of the time by picking the right implant and putting it in the right place. But there is a higher incidence of visible rippling and ridging with this type of round silicone implant compared to the 410 implant. The other thing the studies showed was that this implant is less likely to leak. This implant is less likely to have visible rippling and ridging. And this implant has a lower capsular contracture rate. Capsular contracture just means that the envelope that your body naturally makes around the implant tends to tighten and shrink and round up this normally teardrop shaped implant into a round implant. This implant resists that force of rounding up and changing shape. It's also felt that this implant is going to keep its fullness on top better than the round implant over time. People that have had this implant for a long time feel as though it's a more long-lasting result. What are the downsides of this implant? Well, the fact that it is form stable and it's teardrop shaped with more fullness at the bottom tapering up toward a natural top means that it has to be oriented correctly. If your body makes an envelope that's too big around this implant, or the surgeon makes an envelope that's too big, and that implant has a chance to turn, you get a result that's less than ideal. Whereas this round implant can change position and still be a round implant. The other minor downside of this implant is it takes a slightly longer incision. We're talking about 1/4 of an inch. In my experience over the past 7 years, nobody's had any complaint with the fact that their incision was 1/4 of an inch longer to get the result that they want. I do use a drain tube on these implants, seldom on these. That's just a tiny drain tube that comes out in 3 to 4 days at tops. It's not a particular inconvenience, and it takes away any fluid that might make the pocket too big for this implant. Finally, and this is sort of a taste issue, is that This implant has less of an augmented look. The augmented look is more rounded, more dramatic, volume where a natural breast just doesn't naturally have volume. This implant of the same size will be a more natural, gradual, augmented look. And for some patients, that's not what they want. Allergan has some very good material on the differences in the ultimate shape of these implants in many patients, and it's really helpful. We'll show you that when you come to the office for the consultation. In short, it's a new implant, but it's had over 20 years of experience. It has some really nice advantages for some patients. Some patients it's not ideal for, or we have a few more risks or a slightly higher chance of needing to do a revisional surgery when the implant's used in that circumstance. Not insurmountable odds, especially in someone who has experience with the implant, but it's something we need to talk about in the office. I hope you've found the blog helpful. There's a lot of information on this in the Allergan website. I look forward to seeing you in the office and talking about what it is that you want to accomplish and what implant's right for you. Thanks for watching.